Okay. So an official welcome here to everybody today. Thank you all so much for joining us. My name is Sarah Adams. I'm the Executive Director of Women's Empowerment International. For anyone who may be new to the organization, we are a nonprofit based in San Diego, but impacting women's economic empowerment worldwide. So we have a mission to empower women with tools to work their way out of poverty, care for their families, and strengthen their communities. We do that by funding thoroughly vetted, high impact, other nonprofit organizations that are doing really, really good work around that women's economic empowerment. And so we have two of those partners here today representing Fonkoze in Haiti and Nyaka in Uganda. We have Corinne Rowan, thank you, and Jackson Kaguri. So I am going to turn it over to each of our panelists as we focus today on women's health. We know around our country, there have been a lot of issues around women's health coming up, and we know that the link between health, especially for women, and poverty are so intertwined. The impacts for the women that we're trying to serve are immense, and we want to better understand that. And so that's why we have invited these two partners specifically because of the great work that they're doing to holistically address all the issues that women are facing in their countries, especially looking at health and healthcare. So first, we're going to hear from Corinne Ronan, who will tell us a little bit about their programs. And just for a little bit of background, the bios were provided ahead of time, but I want to just read a little bit about Corinne. She is the executive director of Fonkoze Foundation in Haiti. She is a medical doctor with a master's degree in public health and has led many multidisciplinary teams to design and implement development programs with leading organizations around the world before she joined Fonkoze in 2009. Founded in 1994, Fonkoze is a family of organizations that work together to provide the financial and non-financial services to empower women in Haiti, as well as other Haitians as well, to lift their families out of poverty. Fonkoze won the European Microfinance Award in 2021 for its healthcare program, Boutique Santé, which we are very proud to have supported and helped fund since 2016. So Corinne, with that, please feel free to expand on anything that I just shared and tell us a little bit about what women's health looks like in Haiti and any updates that you can provide on the program that we've supported.
Thank you very much for your kind introduction, Sarah. Can I share my screen? I have a small presentation that I prepared. There we go. I need to go there, and that doesn't work. Yes, there we are. So as you were saying, Sarah, Fonkoze is a family of 3 organizations. We were founded in Haiti by a group of Haitian grassroots leaders and Père Joseph Philippe back in 1994. And now we've grown a lot, and there's actually 3 Fonkoze institutions, which are legally independent from each other, but really collaborating on a day-to-day basis. So there is the foundation, which I have the privilege of leading, and our role in the family is to bring training, accompaniment, and health services to ultra-poor families who are too poor for microfinance, and to the clients of the microfinance institution. The microfinance institution is the biggest of the Fonkoze institutions. They actually have a network of 45 branches, and they provide savings services to 180,000 people and loans to more than 50,000 people, mostly women. And then our third colleague is Fonkoze USA. We have Samantha Gonzalez, who represents Fonkoze USA, who is on this webinar with us today. And they are based in Washington, and they are quite a bit smaller, but really important, raising funds for us and raising awareness of the work we do for people in the States. So the 3 organizations share a same mission, which is to empower Haitians, primarily women, with financial and development services to lift their families out of poverty. We address the key roots of poverty through providing access to financial and non-financial services. And like Women Empowerment International, our goal is to lift people out of poverty. So it's a broader goal, but health plays a particular role in that wider picture because of the relationship between poverty and health indeed. We see that poor people, their health is worse than people who are better off. And we also see that when you're poor, you actually have more difficulties accessing health services. So it's really kind of a double whammy. They have to pay the price in two ways. And that's the reason why Fonkoze started addressing the demand for health services from clients since 2006. So the situation of health for women in Haiti is difficult, to say the least. While they are the backbone of Haitian society, because very often they are the ones who are in direct charge of the health of their children, they are also very often in charge of the local economy. They are the ones who do the buying and selling of goods, bringing goods from one place in Haiti to another. They actually are disadvantaged from in a lot of ways. Like, for example, their wages. When they have wage jobs, they are paid less than men. There are less women formally employed than there are men, and there's more women in badly paid in the informal economic sector in Haiti. In addition, in Haiti, nearly half of the households are led by women, with men coming in and out of their lives whenever the situation makes it possible. So very often they carry the load of the household on their shoulders. Now, in terms of health, as you can see, 49% of the women suffer from anemia, 11% are underweight. Many women in Haiti have been victims of gender-based violence. It's 50 to 70% depending on what definition you use of gender-based violence. Cervical cancer is a leading cause of death for adult women in Haiti, and the mortality rate of cervical cancer in Haiti is the highest in the world, just because people get diagnosed too late and there's very little actual treatment services available in the country. 34% of women aged between 15 and 49 years old use contraception, but 38% of women have unmet contraception needs. So there are still many women in Haiti who would want to have access to contraception, but can't, either because the services are not available close to where they are, or because they don't really trust the services that are being provided close to where they live. So all in all, it's a picture of strong women who have a lot of responsibility, but who also carry a heavy load of illness for themselves and because they are responsible for the health of their children very often. Now, in Fonkoze, we have a range of services being provided by the financial and the non-financial services arm in Fonkoze. Financial services are important. You know, in 2021, Fonkoze Financial Services disbursed $44 million in small loans to over 50,000 clients all through the country, and most of these clients, over 90%, are actually women. And that is important to women's health a couple of years ago, we actually did some research together with Dr. Molly Rosenberg. At that time, she was at Yale University. She's at Indiana University now. And she actually looked at whether being part of microfinance had any kind of impact on health, yes or no, and particularly on reproductive health and on vulnerability towards HIV. And she found a really significant difference. She said people with longer memberships, so who have been part of Fonkoze for a longer time, were 72% less likely to report partner infidelity. They were 4 times more likely to use condoms with an unfaithful partner. And they had, and that's really important, a much higher average general power index. So their capacity to actually negotiate sex and make sure their partners protected their health was much higher than people who were not part of the financial services. So part of what Fonkoze does about women's health is actually through providing access to financial services. The second program, one of the bigger programs in the Fonkoze Foundation this time, is that we work with, today we have around 4,000 women in the ultra poor program. And this is a program that provides accompaniment like weekly visits and trainings and transfer of assets and cash to allow women to build income generating activities. What we've learned is that when people are at that level of poverty, they need, like I was saying earlier, they need health services more, but they actually have a whole range of barriers preventing them from accessing those services. The first one is just financial barriers. They can't afford even the small money partners in health would ask them to pay in the Central Plateau. The second thing is the geographical barriers, because very often these women, the poorest women, live in isolated rural areas and they have to walk 4, 5, 6 hours before they can get to a health center. But the last barrier, which is often the less visible one and it's more difficult to address, is the psychological barrier. Because these women very often think that they have very low self-confidence. And so they're afraid of going to a hospital or to a health center because they feel there's no way anybody's actually going to take their real needs into account. So Fonkoze, through the Ultra Poor program, we take these needs into account by working with a nurse who, for example, will go to the hospital with a program participant. We provide them with a little stipend so that they can pay for their costs. And we, bit by bit, teach them how to become familiar with health services to break down the psychological barriers, but also how to save so that when they need health services, they will actually have a little money that helps them access the health services they need. Now, the program we've worked on together, that, like Sarah was saying, is the program of Boutique Santé. So we were very fortunate. We won the European Microfinance Award for this program last year. We were very proud of that. And we're also really very proud of what we've accomplished in this program with support from our donors and partners like Women's Empowerment International. So since we started piloting Boutique Santé in 2012, we started it in one branch with like 100 women. Today, we're present in 38 of Fonkoze Financial Services, 45 branches. And we've trained in 2021, we've trained 1,300 women to become what we call community health entrepreneurs. So these are women who become like health resources in their communities on a voluntary basis, but who are at the same time leaders amongst the microfinance institution. And what they do is they buy health products from us, and then they sell on these health products to their communities. And in the first quarter of these years, 173,000 families actually use these products, such as oral rehydration salts, iodized salt, product to clean water, condoms, etc., etc. So Boutique Santé is like a platform. It's like a platform. Today, we work with around 650 women all over the country. And what we do with partners like Women Empowerment and others is that we use that platform to provide other health services in the communities. Like what we did last year was we screened close to 50,000 pregnant and nursing women for malnutrition. And we were fortunate, we found only 936 women who suffered from acute malnutrition, and we were able to facilitate their access to healthcare, the same way we do with the Ultra Pro program. So actually accompanying the women to the health center so they feel at ease and they know that someone will will actually help them find a solution for their problem. We also work with a partner organization called ProFamille that provides mobile clinics for cervical cancer screening. I've told you how big of a problem cervical cancer actually is in Haiti. So we were happy that we were able to provide 213 women with access to cervical cancer screening. We're also fortunate, one of the products we sell, and we sell really a lot of, is condoms. And condoms, it's important, and it's women buying them as much as men, because women want to buy the condoms to give to their partners. So that's something that we really promote so that they can be in charge of their own reproductive health. Boutique Santé also plays an important role in providing health services for children. Like last year, we screened over 150,000 children under 5, and we found 3,000 malnourished children whom we helped accessing treatments. Again, it's working with the women to make sure they get to the health center and they learn how to feed their children better, because malnutrition with children is partly a problem of just absolute poverty, but it's also partly a problem of not really knowing well how to feed a child, for example, at the time when it is weaned. Boutique Santé also allowed us to distribute vitamin A to over 56,000 children in 2021. So I wanted to talk to you about Bernadette Joseph. Bernadette Joseph is a chick, so she's a community health entrepreneur. She has 6 children of her own and 2 adopted children. And Bernadette is one of these households that are led by a woman, so she does not have a husband or a partner who helps her take care of the children. She says very often, it's Fonkoze who's my husband, because she's been a client of Fonkoze for the past 21 years. And it's a story of a woman who started out selling little heaps of charcoal at the side of the road, buying in bulk in Port-au-Prince and then selling by little packets in her community. But the work was very physically demanding, and the traveling was a problem for her because of the children she had. So with the support of Fonkoze, she was able to expand her business, taking other products like used clothing. And that allowed her to travel less often and to be more often at home, taking care of her children. Bernadette became a community health entrepreneur 3 years ago. And through Boutique Santé, every month, she goes to the branch in Esch in Haiti Central Plateau, and she buys diapers, products for personal hygiene like deodorants and creams, and health products, the both together, because the diapers allow her to make more money and invest a little in actually having health products available for her community. Bernadette is also very proud of herself because she actually screened over 270 children for malnutrition last year, and she found several that were malnourished and that she could help get to the health center and find treatment. She's very, very proud of herself. She says, I really feel that I have saved the life of these children. And she's right, she probably did. So that's it. That's what I wanted to share with you all for now. I wanted to say a big, big thank you to you all too, because it's thanks to the support from partners like Women Empowerment that we're able to continue with our mission in Haiti. Thank you very much.
Thank you so much, Corinne. So I am just switching around my view here. So thank you so much for that. That was excellent. That was really, really informative. And I really appreciated the story at the end as well. So we're going to save Q&A for the end. So I'm going to go ahead and swap over to introduce Jackson. So Teresa's helping out with the screen arranging. So Jackson Kaguri is the founder and CEO of Nyaka. He's also an accomplished author, motivational speaker, and human rights advocate. He splits his time between the US and Uganda and is about to go back for about a month, I think he was saying, to do some work there. He, let me see, what do I want to say? He's got so much great information in his bio that I could share, but I want to focus on the fact that he started the organization with $5,000 to build a 2-room school for children in his village in Uganda. From there, flash forward to Nyaka just celebrating its 20th anniversary as an organization and becoming the holistic community-based model of an organization that it is. It enables children who are vulnerable to become healthy, productive citizens, as well as the grandmothers in the program that we has been fortunate enough and proud to support since 2014. So Jackson, if you want to go ahead, I think Claire is going to help share some share her screen with some slides for you to go ahead and present on all of that, as well as women's health in Uganda.
Thank you very much, Sarah, for that amazing introduction. Thank you, Women Empowerment, volunteers and board members. And thank you to everybody who joined us today. We are going to be addressing empowering healthy communities. Like Sarah said, I was born and raised in a village where Nyaka is located. And 20 years ago, started the small organization building a school for children who are orphaned because of HIV/AIDS. And that organization is focused more on a girl child as our lead. In our schools, we take girls' health, girls' education, girls' empowerment seriously. 65% of recruitment for these children are girls. Ladies and gentlemen, we could not do the work we do without the grandmothers, who are the women and the cornerstone of our society. And so we are going to focus on the women who are housing these children who go to 3 schools we have started, but we expanded the women grandmothers program beyond the schools to 3 different districts in Uganda. As I was listening to the work being done in Haiti and the numbers, I was here clapping on my own, but also very happy to see that women are being taken care of in Haiti. To start us with this healthy empowerment and women, I'm going to tell you just a quick story. When I was 9 years old, I fell from a tree 200 meters of the eucalyptus tree and landed on a stump that went through my leg from one side to the other. Some of you are in lunch hour, please forgive me, but I bred bleeding from that stump to the hospital nearly died. The only person who rescued me, prayed for me, came to the hospital every single day for 6 months with my grandmother. And my grandmother believed I could not die. And her presence in that hospital, reading the Bible for me every night, though she couldn't read, was the hope that I held on, and it saved my life. So grandmothers are so close to my heart. When I started this organization, I knew I could not do the work without grandmothers involved. And in the picture, you see that we took in April of 2022, a few months ago, I was meeting the new groups of grandmothers who are excited about joining, and also so they see hope in healing, and we're going to talk about their health. So the organization was started in 2001. The response was due to the pandemic of HIV/AIDS. Now we are dealing with the pandemic of COVID. The organization is based in a home where I was born and raised, and we have expanded it, addressing issues facing children, all hinged on a foundation of women. Next, Claire. And these women, ladies and gentlemen, have continued to raise superstars. Our mission right there is to educate, we empower, we transform vulnerable and impoverished communities in Uganda, and ensure that everyone has the chance to learn, grow, and thrive. And ladies and gentlemen, we have raised amazing children. We have empowered these communities. Next, and you're going to see it in evidence right now. And you see, we also carefully chose pictures of girls. One of the things we do is to make sure that before we take a picture of any of our children or our grandmothers, they are dressed up. It is picture day, and they are smiling, because our mission is to make them happy, empower them, not to dwell on what they have gone through. So we have 2 primary schools, we have a secondary school, we have a vocational school. We educate more than 700 students in these schools. We have graduated doctors, we have graduated engineers, we have girls who are nurses now. The work we are doing in the beginning to empower orphans, now we have orphans who have come back to serve their communities. We have an amazing group of girls who are doing STEM and are computer engineers. Keep going. And recently, while I'm talking about these girls who are empowered, one of our girls who are at university were the representative who won climate change essay and went to be an ambassador for the day with the UK ambassador. Our community programs stretch from the holistic approach you heard about. We do farming and feed children every day. We have libraries so kids can read books. We have gravity water systems so women don't have to spend all day fetching water. Water comes from on their doorsteps. And we have a program which we started when one of our children was raped, talking of health, going to school. So the sexual gender-based violence program is the program that advocates for girls, we call them victors, and boys who are sexually assaulted, and now we are fighting the entire gender-based violence. Next. And we talk of gender-based violence, which is part of women's health in our communities. We started in 2015. This program has helped more than 300 survivors and assisted in prosecuting 90 perpetrators. For a girl who has been raped, rape is an issue of in the entire whole world. You've heard about the Me Too movement in this country. And when we think of this big issue, we think of resources that go with it. Women empowerment supports Nyaka and so with microfinance and exact word women empowerment. One of those empowerment tools is that motorcycle you see in the picture. Bosco, who leads our legal advocacy with gender-based violence, will get on that motorcycle in the middle of the night when we hear a case has happened somewhere. With a cell phone and one motorcycle, we've been able to accomplish all this work. And with the support of women empowerment, we continue to do legal advocacy, health outreach, and more in the community. Next. The Nyaka supports community health through 2 clinics. In our whole holistic approach with schools, water, food, we have a clinic we built ourselves. When we started earlier on with Nyaka, our children coming from being orphaned as HIV/AIDS orphans, some of them were born with HIV/AIDS. So we, under our approach, started putting small counters in classrooms so children can have medical care in the classrooms. Ladies and gentlemen, that medical care included sanitary products. When we talk of health for women and for girls in our community, one of the bottlenecks why rural girls do not go to school is the lack of sanitary products. So I've been this man who goes around the world advocating for sanitary products. Men have asked me, how do I know all this? My sisters dropped out of school many times because they didn't have sanitary products. Within the growth of those counters in the classroom, we built our own clinic, which now serves the community, which was huge during the COVID. And at this clinic, where the uniform Kutamba, that's a different school, Purple is a different school, they both have clinics and we treat everybody, but especially women. I'm going to tell you a story right now about a doctor from Michigan who we sent to Nyaka Clinic to address cervical cancer issues. In my community, most of the medical personnel are men and nurses are women. When I sent this doctor, he said to me, Jackson, do you think women in your community will allow me, he's a gynecologist, to examine them? I said, yes, when you get there, tell them Jackson sent you. And he thought I was joking. Because Nyaka has a very good reputation and every program we have done has addressed issues facing the community, most especially the women, when we made an announcement, Dr. Lee said, Jackson sent me to do this, so please show up. The next 5 days, I'm going to be at the clinic. The shocking statistic, ladies and gentlemen, this doctor had practiced in Michigan and had only seen 5 cases of cervical cancer in 35 years. In 5 days at Nyaka, he examined like 250 patients every single day. And every day he was confronted with more than 50 cases of cervical cancer. Lots of cases of syphilis and gonorrhea. Because of patriarchal behavior, even when men would go out and bring an STD in the house, the woman is scared to tell him because she might end up getting bitten. Or she might go and get cured without telling the husband, but then come back because she didn't tell the husband and recontract it. So before COVID started, we were beginning to look at this women health pattern with Sparrow Hospital in Michigan, so we can do more tests and bring results and try to get pap-smears, the tests, but we didn't get to do it. That means our women are still suffering. The only services they get is through our clinic. Let's move to the next one, Claire. Through our clinic at Nyaka Primary School. But through all these diseases, whether it is malaria, whether it is STDs, whether it is cough, a woman in my society always comes last. When I was growing up, there were so many instances where my mother was sick, but when a child got sick, the child got treatment before the mother. When my dad was sick, he got treatment before my mom. We have changed that trajectory through our grandmother's program. Women Empowerment has worked with Nyaka since 2014 to support microfinance. Microfinance, when we speak of finances, many of us think of big amounts of money. This is where we start with $20 a woman. They make baskets, we buy those baskets, we sell the baskets and send back more money. As of today, we have closed $250,000 US through microfinance. The grandmothers, you see, many of them have lost their adult children, but they have done something extraordinary. They are adopting and fostering children in the community so we can raise the next generation. The gap that HIV/AIDS left has grown so big. Orphans have always been there. When I was growing up and the generation before, when somebody died, an extended family took in those orphans. Because of HIV and AIDS, 2 million children were orphaned in Uganda. Families got overwhelmed with burdens of what to feed the children, how to raise them. So grandmothers stepped in that gap and became the parents after even raising their own children. Next. And so we have continued to serve. I love this picture, ladies and gentlemen, that big smile of a woman who is now empowered. This woman is one of the 20,000 grandmothers we serve. And the number is in the slides, so you can't say you didn't understand my accent. 20,000 grandmothers are caring for 86,000 orphaned children. These women are grouped in 253 grandmother groups. Each one meets every month at a place of worship within the area. And one of those 253 groups, ladies and gentlemen, is named after a former member of Women Empowerment. I was there when we launched it. It's the only group that is named after somebody, because Women Empowerment has supported these women, have sent groups to visit. A group was named in that honor. So microfinance, which starts all the small businesses, basically you are looking at 20,000 entrepreneurs. Ladies and gentlemen, this is in an area where women never had a right to own land, to own a house, to own a business. When I was growing up, any money my mom made, she brought it and gave it to my dad. The dad made a decision on that money. We have changed that to the extent now women own their own businesses, open their own bank accounts, construct homes, and get additional support they need. During COVID, our grandmothers, next please, were the ones who took a lead on wearing and making masks. Before masks were mandatory in the USA and all over the world, our women, one on the right-hand side, ladies and gentlemen, is 105 years old. Grandma Deborah has raised the young man who is graduating from medical school this year. And Grandma Deborah wore a mask before a mask was required. Of course, you see those are made out of cloth. They are not medically proven, but we wanted them to be the champions, and they have continued to be the champions. Grandmothers have also set an example where now we work with grandfathers, but their health continues to be our #1 concern. We take them through women who are trained as community health workers. They go house to house. We continue to provide the support. And these grandmothers, after getting $20, we are at a point now where we are graduating them from a program after they have met their best needs. So Nyaka microfinance is growing, and as women make more money, they are saying we can step out and continue to do our business and let the ones who have not got microfinance start. So they are selflessly giving back, next please, giving back to other women in the community. The Women's Health at Nyaka, so far this year, 1,971 women have been served through Nyaka's health programs. That is compared to 938 men. So priority is given to women, and we know because women don't have resources, many of them, they will put their health aside, which is why we focus most of them. Predominantly school-age girls and grandmothers face many obstacles. We do focus our clinic on those. Clinics offer vaccinations, health screenings, COVID testing, pregnancy tests, dental care, and more. Within our community, we are the only place that have dental care. You saw the picture previous of the big smile. People are born and die without ever seeing a dentist. Nyaka, through the support of Women Empowerment and many supporters around the world, we've been the first place to provide clinic, provide vaccinations, provide pregnancy tests, get girls to attend school, whether they are pregnant or not. And you know, during the COVID, there are more pregnancies, young girls getting pregnant more than other times. More women didn't report during COVID-19, but Nyaka took motorcycles and went wherever they were to to serve them. Issues beyond our scope are referred to the local hospital, and we have a part-time doctor who comes to our clinic to handle other resources. And we do send medical personnel volunteers. Before COVID, we did health missions, and we are going to resume that. Any of you who ever want to come to Nyaka, please come. We will have work for you to do. Next. The effects of COVID-19, ladies and gentlemen, like our previous speaker said, the challenges were huge. We had reduced access because of lockdown. Uganda was locked down for 2 years. That means perpetrators all went after the girls. Abusive husbands were beating on their spouses. Nyaka staff kind of pivoted and went more into visiting homes, taking materials, but also checking on our women. In fact, unfortunately, the woman who you see in this picture passed away during COVID because of high blood pressure. So we talk of women health, we have high rates of death because women are not getting the treatment they deserve. Next. We have empowered so many, and Rosemary, who you see in this picture, started out as, in fact, some of you women empowerment who have visited have met Rosemary. She's the one who is always singing, giving a speech. She started making baskets. She graduated into a tailoring program. The amazing table mats she's holding right now are made with the local cloth, and they embrace so many houses. We have a store, Etsy, online, where some of these things can be ordered. Healthy women make healthy communities, ladies and gentlemen. And if healthy woman in a house is healthy, the children in that house will also become healthy. So the ability to access free quality medical care, regardless of income, gender, or anything, is our focus for these women. We train them in local languages. During COVID, we ran radio programs every week. We still do this so women can understand. Every material that is printed by the government is in English. Nyaka is the only place that translated these materials into local languages so our women who don't speak English can still have access to them. Next, Claire. Next is a huge thank you. A thank you to all of you. A thank you to our sisters in Haiti. I thank you to Women Empowerment. And many times when I give these speeches, somebody said, you don't have a woman who can give the speech. I have been a feminist and advocate for women. You heard what my grandmother did when I asked her why she would come every day for 6 months into the hospital. She said, Jackson, God created you for a purpose. To this day, ladies and gentlemen, I pray to God, give me the courage, give me the power, give me the life so we can serve as many women, so women can learn how to read, women can put their health as a priority, and empowered women make empowered communities. We would not be able to do this without women empowerment and the support you give us. Thank you on behalf of everyone we have served and more we are going to serve in the future. Thank you.
Thank you so much. So let's see. Let's get our panelists all back here. So thank you, Jackson. Thank you so much. Thank you, Corinne, for all that you shared as well. And I want to take a few minutes to open this up to questions from anyone who's joining this discussion today. If you have a question, you can go ahead and raise your hand, or just go ahead and unmute yourself, or pop a question into the chat box. So, okay, I see Christy.
Yeah. So yeah, I've got many questions, but I'll first start with Corinne, and say it's so nice to, I don't know if you remember, but I did have the pleasure of coming to Haiti here a couple of years back and meeting with you with a group of us from Women's Empowerment. And I know though that USAID had provided a huge grant for you guys for the last, several years, and that has ended. I'm just wondering how, if any of those funds have been replaced from other grants organizations, or how you guys are doing without that money, and what changes how has that impacted you?
So, the grant we managed was a relatively big USAID grant over 5 years, which ended last year in December. And you know, it really allowed us to grow Boutique Santé to cover almost the whole Fonkoze network. However, it also gave us the possibility to give the women some incentives to really maintain a level of activity that we can't maintain without USAID funds. But that doesn't mean Boutique Santé disappeared. So what happens, just to give you an example, is when we had the USAID grant, we had 35 nurses, 1 nurse per branch, because there were screening meetings and there were a lot of malnourished children we had to supervise. Now we're working with 18 nurses, so about half of them. And most of these nurses are now working with CHASE in 2 or 3 branches. So the training activities are still happening. The buying and selling activities are still happening. The screening services are still happening, but just not at the same level. So women would just screen the children in their immediate environment instead of going out in a lot of other places. So in a way, being weaned off USAID funds is good for us because it allows us to regroup on building our own sustainable model. That's one thing. On the other hand, of course, we continue to work to find other donors who can help us. For example, we're working on developing more cervix cancer screening services. We're looking for funding to help more CHASE community health entrepreneurs do screening for hypertension. So we are looking for other funding, but right now we're down to Fonkoze Boutique Santé's, I would say, backbone program, which is actually a good thing for us. Also, the other thing I must say is that USAID really likes us a lot. So it looks like they will actually be giving us a new grant by the end of this year, which will be partly for our Ultra Core program and partly for our Boutique Santé program, but they do continue to be interested in working with us.
Thank you.
Hi, I'm Sandy Hoover, and I also had the pleasure of visiting both Haiti with Christy and also Nyaka. So nice to see you, Jackson. I was wondering, and maybe we can start with Jackson because I think Corinne addressed this somewhat, but as you look to the future, what do you see as some of the biggest challenges to successfully implement your program goals?
Okay, good to see you once again, and thank you. Yes, you visited Nyaka, thank you. What my sister was saying, Karim, about Haiti really is applicable to Uganda. During the COVID, what we've been doing is actually partnering with the USAID in Uganda and other international partners. As of now, we have the largest number of vaccines that we have implemented, and our data, thank you again to Women Empowerment, now we are doing monitoring and evaluation with you in collaboration with Paul in Uganda. What I see in the future, what is happening, we actually want to continue graduating women who are reached basic level of sustainability. We want to encourage our women and other graduates of Nyaka programs to start their own businesses. We want to run businesses and grow the economy starting with women, which society thought, many men thought women cannot do anything. Now they have proven otherwise. We have women you visited and shook hands with whose husbands are still alive. These women are now employing their husbands and their grandchildren. And guess what? Their bank accounts are bigger and fatter compared to what their men had ever been able to save. So we are not only changing the economics of the area, we are changing the mindset of the society. The grandchildren who are now employed by their grandmothers will never treat a woman the way their fathers and their grandfathers treated their mothers and grandmothers, because now they know better. They are empowered. Here, the doctor who's graduating from medical school is a well gender balanced young doctor who now sees this neutrality, but also the focus on how grandmother at 105 is still going to meet other women and get the support she needs. She could have died earlier. She's still alive because other women are supporting her. So yes, we can support, we will get partnerships. Yes, we can continue to pump money into microfinance, but until these women continue to grow their own businesses and create an entrepreneurial society of businesses. My sister runs a catering company in this village. She makes more money than me, the CEO of Nyaka. She owns more property than myself. She puts up a building every year. The other day, I'm in Uganda, and she said, I just bought another property for 100 million Uganda shillings. 100 million Uganda shillings, about 70,000 US dollars. Ask me 70,000 US dollars right now, I will cry the entire day. I will go to the bank to borrow it. My sister went and bought a property with it. She works with these women. What does she do? She rents chairs, she cooks at funerals, she cooks at weddings, she rents tents, she cleans them and rents them again. And these grandmothers in my village are watching her. She's divorced, which is like a curse in Uganda that you are divorced. But now she employs 300 people, 5 different departments. She has a hardware store. Some of these women, when they are discouraged, I tell them, go talk to Faida, my sister, and she will give you ideas how to market. She's on radio every week advertising. I taught her how to advertise. When I go to Korea, I bring ideas and share them with her. And that's how we are going to build this economy, not through donations, not through more, but building businesses. Our children need to do their own clinics. They need to do their software engineering. They need to create apps that will allow grandmother to access money on phone. Finitech is something we are going to do, which is mobile money to mobile money. Even grandmothers who can't read and write, ladies and gentlemen, those 253 groups, I'm looking for smartphones, 253, so each group can send money to each other rather than use cash on a motorcycle. Don't get me started, I can't talk. I will yield my time for my sister Karim to speak. Thank you.
Thank you.
Thank you. Well, we are just about out of time for this excellent discussion, which makes me sad. I think we could all kind of sit on here and listen to more stories that you can share and more about the really impactful work that you are doing. But it's my job as timekeeper to respect that boundary and respect your time as well. So I want to thank you both for the really, really great work that you are doing. I think one thing that's really struck me in hearing from you is how you are empowering the women in your programs to be the agents of change for these really big, difficult, systemic, complex issues in your communities. And because of that, it's creating this ripple effect, and it's creating sustainable change. And we as an organization are so proud to be able to support the work that you are doing, and so appreciate your time here today and sharing your insights with us. We are going to drop some links into the chat box to share our website. If anybody has not signed up for the WE newsletter and would like to get on that list, please go ahead and sign up for that. If Samantha and Claire, you have any links for your organizations, Fonkoze and Nyaka, that you would like to share, please put those in the chat box for everyone too. And before we wrap up, then I will give each of you 1 more minute or 30 seconds to share a final thought with the group. So Corinne, would you like to go first?
Yes, I'll be fast. Thanking Jackson for the way he shared about Nyaka and about the empowerment of women over in Uganda. I've been very interested in your program, empowering grandmothers to actually take care of over 20,000 children. The work you're doing is really amazing. It was interesting to see how we both are working on creating businesses, becoming sustainable, and continue to work with donors to really support in key areas. I feel we have a lot in common, so I was very glad to meet you, Jackson. Thank you, Sarah, for inviting me, for having me, and for organizing this interesting meeting. I wish you a lot of success in your continued mission.
Thank you. Jackson.
Thank you. Well, again, this is an appreciation. A few words again, women empowerment got us connected, Karim. So thank you, women empowerment. I love the work you do. I'm actually going to be in close to Haiti, and I have some resources actually. Claire, who was doing my the slides, is our fundraiser. Claire can wave. She and I are going to Dominican Republic. And if we had a chance, we would cross into Haiti and see. And we have some other resources, partners who partner with us on different programs. We can also share with you and women empowerment. Thank you once again. I, like my grandmother said, we created for a purpose. I'm still looking for that purpose. That purpose helps women in Haiti and women around the world. That's why when these opportunities come to speak and to share, I am more than willing to do it, because the work we do is so important, so crucial. The women are the cornerstones of our societies, and if we don't empower them, our society will continue to not grow. Thank you, Women Empowerment. Thank you, Sarah. Thank you, all board members and all participants. And we will continue to work until they rest. We want to rest.
Thank you so much. And thank you everybody who joined us today. I really appreciate your time as well. We will send out a link to the recording afterward. And please feel free to share it with anyone, share it with your networks, share this information that you received today, and continue the conversation. Thank you. Have a great day.
Bye-bye, everybody.
Thank you.
Thank you.